welcome back to another episode of Hybrid Healing Hour. Today we are going to be discussing ALS, which stands for Amyotrophic Lateral Sclerosis. We have a very special guest with us today who is also a good friend of ours and has clinical experience with ALS and personal experience. So please welcome Joe DiNoia. Why don't you go ahead and tell our audience today a little bit about yourself and how you got to where you are today.
Well, thanks, Deanna. Thanks, Dr. Marias. It's really nice to be here to talk about something that is probably not spoken about enough, and that's a good thing. Sometimes I tell people, you probably will never meet somebody like me, and that's also a good thing because I have a unique family history of ALS, which is also Lou Gehrig's disease. A lot of people know it as that. And today's an important day for me because 26 years ago today, my mom passed away of ALS, and I'll never forget her diagnosis. She was in a car accident, and shortly after, some symptoms started happening, some weakness in her legs, and some funny things started happening, and it was associated, they thought, to the car accident. Then things just started progressively getting worse. She fell down while serving dinner, came home from school. She was sitting on the steps all day because she was unable to get up. And finally, she was diagnosed and told me that she had the disease that her father passed away from. And that was incredibly hard to believe because back then they didn't know that there was a genetic, they didn't know the gene. It wasn't identified yet. So we were told this was 1 in a million. This is never going to happen to you, your family ever again. This is something that's totally unusual. And she basically told me that she had Lou Gehrig's disease. I didn't even know ALS. They just called it Lou Gehrig's. And so actually, on my forearm, I have a tribute to Lou Gehrig showing July 4th, 1939, his famous luckiest man speech, where at that ceremony, he stepped down voluntarily. It was an amazing story. The guy known as the Iron Horse played the most consecutive games in baseball.
He was a New York Yankee,
New York Yankee. I mean, born and raised, played for Columbia University. This guy was, as the Iron Horse, just a strong man, and he was withering away from what they eventually found out was ALS. And so it affects roughly 5 in 100,000 people. So it's considered rare, but unfortunately, we seem to all know somebody
exactly
that's been affected.
Especially out of just us three right here, which is very interesting. My best friend from high school, her mother just recently passed away from ALS, and it was a tragic story. I mean, she got the diagnosis and passed away within 1 year. It was very rapid and progressive.
Yeah.
In my career, I've probably treated a dozen patients with ALS, and it's a devastating disease, especially when you see it in the later stages. When I worked in the intensive care unit, we used to see some of the ALS patients on ventilators. Yeah. But things have come a long way with ALS and with diagnosing ALS.
Yep.
Right?
Yep. There's some treatments now. When my mom was diagnosed, and for those of you that aren't aware, which is everybody outside this room, I also represent one of the approved medications, and I'm talking out in the community with neurologists on a daily basis. And one of the things I talk about, that initial diagnosis to a patient is like 9/11. You know, we all remember that day. And it's how you relay the information that's going to really affect that day for the rest of their lives. My dad remembers the weather, the building in New York City, the doctor. He remembers how callous he was in his delivery of the diagnosis. Back then, there was no treatments at all. So it was, you have ALS, you're going to die, settle your affairs, consider moving to a one-story house, and try and live as best you can. And that was it. So the great news is now, when a person gets that unfortunate diagnosis, it's you have ALS. We have treatments now, treatments that slow the progression. There's a lot more that we know now. There's clinical trials that we can funnel you toward to get, to see if you qualify for. So I think in my goal when I'm dealing with the physicians in the community especially is to diagnose quickly and treat quickly. One of the challenges is that a lot of the neurologists, They obviously want a second opinion, and the patients want a second opinion, sometimes even a third. They want to believe that the doctor's wrong, crazy. They don't know what they're talking about over there, right? So that further delays treatment. So it may take 2 or 3 different neurologists to get accept the diagnosis. But let's just take a step back. Before they even get to a neurologist, what's happening when the disease begins? It's different for everybody. Unfortunately, ALS, they don't know. Nobody knows why it happens, to who it happens. They have no idea why it starts, when it starts, how it progresses. Unfortunately, your friend's mom was very brief. She didn't have much time, a year. There's some patients that live 5 years, 8 years. There's some that live even longer.
Right.
But one of the interesting things is that, and unfortunately, there is more that is unknown about ALS than that is known about ALS.
Absolutely. As I'll say studying, for this podcast, that's what I realized. It's very complicated. And you have to think about, there's so many other neurological conditions out there and neurodegenerative conditions out there that you have to rule out as well. So let's talk about, what is ALS?
So ALS affects the motor neurons that send signals from the brain to the spinal cord to voluntary muscles throughout the body. And as ALS causes these motor neurons to deteriorate and eventually die, the signals are disrupted and muscles weaken and atrophy. And that's typically what we think of with ALS. And, one of the classic representations of ALS is Stephen Hawking, right? He had ALS, and he's actually an unusual case because he had ALS for quite a long time.
Yeah, he was actually diagnosed back in 1963, and at the age of 21. He was a very rare case, I believe, and but he survived for 55 years with the incurable condition. As you mentioned, Joe, the life expectancy of a person with ALS averages about 2 to 5 years from the time of diagnosis, and many people can live with the disease for 5 years or longer, but the prognosis is just not well.
Yeah. And just going back to my personal story, which I earlier said, you don't want to know too many people like me. Not only did I lose my grandfather, my mother's sister, 2 of her brothers, 2 of my first cousins. We just lost my cousin, Jennifer, just a couple of months ago. She's 51 years old with 4 beautiful children.
Wow.
Very young age. So yeah, the cause for me, just ALS awareness is very meaningful. So I'm really thankful to be here and talk about it.
Yeah, and I think that more people should be aware of ALS, even though it's going to be highly unlikely that anybody listening to this podcast is going to get ALS. Correct. But they may end up knowing someone with it. So, like we said, about up to 10% of cases of ALS are familial, which means that there's a genetic mutation as the underlying cause. But the other 90% or more cases are considered sporadic, which means there's no genetic cause. And we said that the average age of people who develop ALS is between 40 and 70, with the average onset of about 55.
Yeah, like you said. How old was your mother, Joe?
So she was 42 upon diagnosis. Wow. And an interesting thing, there was a moment where my father had to make a decision to put her on a respirator or not. And he chose to put her on a respirator. He was under the belief that they were close to a cure. And so he made that decision, and he regretted it later in life, that my poor mother was on a ventilator for years. She was unable to move, unable to do anything, really. And one of the things that's very important to understand about ALS is it typically does not affect the brain as far as thought and feelings. And so an example I'll give is, I remember I was a teenager. I was probably 18 years old. And my friends were outside. It was Friday night. We're going out, beeping the horn. No cell phones back then, right? So they're beeping the horn. Come on, let's go, let's go, let's go. And my mother's nurse said, come here, your mom wants to tell you something. And we had an alphabet board. So I would move my finger, and when I came to a letter, she would blink, and then she would spell out. And she spelled out for me, close the garage door.
Oh, my gosh.
And I will never forget that moment for the rest of my life, because it really hit home to me that this was a woman trapped, but still a mother.
Yeah.
Still worried. Still, I mean, really, it's
she was
very,
still
very sad.
functioning inside.
Fully functioning.
But could not move and couldn't breathe on her own.
And when you're having a bad day and you're thinking that things are horrible, My mother lost the ability to blink.
Oh.
So imagine that, just anybody listening or watching, keep your eyes open for 30 seconds. Tell me how that feels. So we had to put drops in her eyes. And, it's unfortunately a very emotional thing. And that's the other thing that people forget about, the emotional support that people need, that the caregivers need, because what happens is with ALS, it becomes hard to visit that person that you remember as strong and healthy. And then to see the decline is really emotionally difficult. So it becomes a very lonely life for somebody with ALS.
Well, I think when people talk about ALS and we talk about the neurodegenerative conditions, we think about our limbs, right? Like our upper extremities, our lower extremities, the ability to walk, the ability to grab something with your hands, open a door, open a water bottle, right? But what we don't realize is we also have muscles in our lungs, right? Our diaphragm. We have swallowing muscles, blinking with the eyes, the ability to open or close your mouth, to smile, frown. We have muscles everywhere. And so this eventually affects all of that. I mean, constipation could be an issue.
Absolutely.
And then if you have dysphagia, which is or the inability to swallow well, then you're not eating, and then you get even more constipated. Then you have it's just a spiraling effect that people don't understand how severe this condition gets. And like you said, you eventually get on life support with that.
You mentioned Stephen Hawking, a couple points about him. Very, very unusual case. What a lot of the thought leaders think is that we will learn in the future that ALS is an umbrella term, and there are many conditions underneath, because it starts differently for everybody. It could start with the tongue, the mouth, the swallowing. Some people might be drooling. For some people, it starts with the legs, some the arms, some the hands. So it's so different, so many different ways that we may learn in the future that all these people had different diseases that we just call ALS right now.
That makes sense. I mean, it's so hard to diagnose. I mean, it's a clinical diagnosis. Yes, you can do some laboratory, some labs, finding, but essentially with that, I saw it's labs that check for inflammatory markers, essentially. I mean, blood cell count, your CRP, ESR, things like that, and in possibly even like looking for infection like Lyme disease or HIV. But for the most part, you can do like muscle, like nerve conduction studies, electromyographies, right. And maybe even a muscle biopsy. But it's still, all of this essentially is just ruling out other differential diagnoses.
That's right. Yep.
And that's why it's missed so many times, is because it can mimic other things, and people go chasing down other diagnoses until finally someone pins it down and says, this is what you have.
Well, and think about the timing, right? It takes down here, 2 to 3 months to get in with a neurologist. As you mentioned, Joe, you go then for a second opinion, another 2 to 3 months. By the time you get some of the testing done, that's a month out. Then to get the results is another 2 weeks at least. Then to talk and review those results with the neurologist, another 2 weeks. I can imagine how everything is unfortunately so delayed and pushed back, and how frustrating this can be as you are continuing to deteriorate. It's unfortunate, right? It's appalling, unfortunately, how long this takes.
And that's one of the things that I do. My main focus is awareness when I'm speaking with the physicians, but also trying to encourage them to diagnose and treat as soon as possible. Yes, absolutely, get a second opinion. But in the meantime, start the paperwork to get them on medications, because that takes time too.
That's what I was going to ask you. I was actually discussing this with my friend whose mother just passed away recently. And she was saying, if they even think this could be a possibility, right? And they've already ruled out a few of their neurological conditions. Can they not just start the medication? Is there, harm in doing this? Or I'm sure there's a whole approval process, but as we say, it's a clinical diagnosis essentially. So why not just get started?
Yeah. What I'm told is that a lot of times patients don't want to accept it. No, I'm not doing anything, because they're really holding out hope that it's not. I think
the denial.
It's the denial. And a lot of times, unfortunately, patients then realize, oh my God, now I need this and I want it now. But unfortunately, the world we live in, there is a process, and there's documentation that needs to be sent in. So I'm always trying to get people to take action, now.
Yeah.
Yes, get the second opinion. And then guess what? Don't proceed with the process. But in the meantime, get it going, so.
Can I ask you a question from the pharmaceutical standpoint would be, is there a benefit, like with your medication that you represent or any of the other one that's out there, from starting early? Like, is there the sooner the better?
Yeah, all the medications that I'm aware of nowadays, the ones that are investigative, one of the endpoints is preservation of function. So there's an ALS functional rating scale called the ALS FRSR, which stands for revised because it's been changed. But that's a 48-point scale. So it's 4 domains, and it's a questionnaire, 12 questions in each, rated on a scale of 1 to 4. So just use it like fine motor, gross motor, bulbar, and there's questionnaire. And so if you have full function in that question, it's a 4. For example, cutting food, it would be a 4. Climbing stairs, 4.
So that's if you can cut food, if you can climb stairs.
4 would be the most function.
Gotcha. Okay.
So the 3 of us in this room, if we did that, we'd have a 48, a perfect score, because we have function in all these things. But as a patient progresses, they lose about 1 point per month.
Wow.
So, let's start with this. By the time they're diagnosed, they're probably in the 30s, right? Because they've already declined. That's why they're there. So they're probably in the 30s. And then each month, on average, they lose another point. So let's say, according to like what you said is a good example, 2 months for another opinion, maybe 2 months for another opinion, maybe 2 months to get your drug approved. So now that's like 8, 10 points.
Right.
That's the difference between walking and not walking. I mean, those are big numbers. And it's different for everybody. And that's just generalized because nobody knows why people progress fast or slow. And there's no telling when it stops, when it slows down, when it speeds up. There's so many unknowns, but it's really important for patients with ALS to track their progress. And it's something that's not, I'm sure you guys haven't heard of this. It's not something that is used clinically every day, but it's used as in clinical trials. It's used in ALS clinics, and it's used by patients to track their progress.
Do you know some of the other questions on there? So I like because just to kind of get an idea of how this affects activities of daily living, right?
It's all daily living. Yeah, it's speech, turning in bed, swallowing, cutting food, basic stuff. Handwriting, I believe, is on there. So basically day-to-day stuff that, hey, what can I do and what can I do? I
think it's all things that we take ourselves for granted.
Yeah, and just something that, just to highlight the importance of this, a lot of times the medications that are available, not just probably with ALS, but they depend on certain I guess, data points like this. So, for example, drugs might be approved if you have a 2 or greater in all the categories, because in order, it's about preserving function. That's what the studies show.
Right. So if it's less than 2.
So if you wait, to my point in trying to get drugs approved as soon as possible, if you wait and it progresses too far, it's going to be potentially harder to get any medication.
Right. So because they're going to say, well, what are we preserving?
Correct.
Right?
Correct.
Wow.
Yeah.
And when it comes to loss of strength, I've said this before on previous podcasts. I've always believed that grip strength should be a vital sign. We should be measuring people's grip strength and monitoring year after year and seeing if there's deterioration. And people who have access to a grip strength measurement device at home should just track their own and just keep track of it.
That's a very good point.
On that, we can check the grip strength in each hand because, back to like symptoms of ALS, it's asymmetric limb weakness is the most common presentation of ALS in about 80% of the population, and upper extremity onset is the most often heralded by the hand weakness. But that can also begin in the shoulder girdle, they say, the shoulder girdle muscles, but it's typically in the hand because we use our hands more so. You don't always lift your arm.
Yep.
And while we're talking about symptoms, let's talk about fasciculations. Fasciculations are one of the early symptoms, and I've seen it in our practice where someone comes in with fasciculations, and of course the first thing they think is that they have ALS, especially if it's a medical person.
Yeah.
Right? And everybody has fasciculations. Everyone has experienced these. When you have your eyelid fluttering, that's a fasciculation. It's a rapid movement of a muscle.
Sometimes you can even see it, like in your shoulder. After I've worked out, sometimes it's just a twitching of I'm like, oh.
I have a very, very interesting story directly related to that. So two and a half years ago, I was somehow blessed to have received a negative diagnosis on the genetic component of the ALS that runs in my family. So that was an absolute miracle and something I wasn't expecting. I lived my life thinking that I was going to get ALS. It's just a matter of time, and I'm going to just live my best life responsibly and be the best person I can be. So then I get this news that somehow I'm negative. And so what's interesting about that is before that diagnosis, I had fasciculations in my right leg like crazy. I planned my funeral probably 100 times, because these fasciculations, of course, I diagnosed myself and I'm getting, I haven't had a fasciculation or noticed one ever since. So
it doesn't surprise me. I mean, when we get on that spiral and we have that thought like, I'm doomed, it's going to happen, then you start having these random symptoms that are correlated, or, we can mentally create that.
It's powerful. It was definitely doing it for me.
Yeah. And think about it. I know almost every medical student, PA student, like whenever we're reading the book and especially going through psych, oh my God, you're like, oh, I've got OCD. Oh, Absolutely. I've got anxiety. Like you immediately think you have every condition you learn.
That's
but
right.
It is, exactly. Especially with your family history being so strong. But let's talk more about that. 10% is actually familial.
Yeah.
So
the SOD1 gene is the gene that is in my family. It's unfortunately very, very powerful. It's I was actually going to Columbia University up in New York. Our family was involved in a trial, still involved in a trial, because it's kind of unique. They've treated my whole family going back, Columbia Presbyterian in New York City. So I was going every other year for EMGs, which are not very pleasant. They're not fun.
No, they're not. They're painful.
Muscle biopsy, skin, blood, spinal tap. That was interesting. That was eye-opening how I didn't realize that it wasn't done with radiography or anything. It's just, okay, bend over now, and I'm going to just insert this needle.
Large needle.
A large needle right into your spine, yep.
So that wasn't fun. But what was the question? I
was saying how it's genetic, and you're participating in you're working with, where'd you say, University of Ohio? No.
Columbia Presbyterian in New York City. Okay. Yeah. So I guess I've gone through all the testing you could possibly go through. And I guess that's what kind of motivated me to get involved and find and do the test to see if I have the gene, because there is a new drug that was recently approved, tofersen, that is the first for the genetic form of ALS. And that's a very promising development. But what I'm really, really excited about is they're taking people like me who have the gene in the family, and they're testing, in a trial called the ATLAS trial. And so if I tested positive, and this is why I got tested, they would have enrolled me into a study where I would have just done monthly blood work, and they're able to tell when ALS in the genetic form, when symptoms will present based on the protein level and a certain protein level in the blood.
Wow.
So you do the monthly blood draw. Hopefully that you don't, everything's good.
So they just monitor the level, and then they as it might, what we'll say, increase, they can determine the triggering onset.
Now you're going to go into the next phase of the trial, which is, 2/3 treatment, 1/3 placebo, and monitor, because they think that perhaps they might be able to slow or prevent. I mean, not only slow, but maybe severely, hopefully dramatically delay onset of symptoms. And who knows? Maybe with some miracle prevent it altogether.
Yeah.
Nowadays,
think about it. That would cut off 2 years.
Oh.
Right off the bat, just from diagnosis, because they're able to tell you're not even presenting with symptoms yet, but we're going to treat it. That's, I'm sure, the ultimate goal for both of you in anything, if you can prevent something.
Absolutely.
Yeah.
And just to show how lucky you truly are, a child of a parent with familial ALS has a 50% chance of developing the disease. So 50-50 chance that you could have had it.
Yeah. And it's 100% once you have the SOD1 gene, it's 100% chance that you will get ALS. It's just a matter of when.
Wow.
So as you age, the likelihood just continues to go up.
Can I ask how did you get involved with Columbia Presbyterian in New York?
Well, because my whole family's been treated there, because there were 7 of us in the family, and that is it's the Lou Gehrig Center for ALS. So they have, the ALS Association has centers of excellence across the country. We are very blessed in South Florida to have 3 ALS centers of excellence. There's one in Fort Lauderdale at Holy Cross. There's one at Nova Southeastern in Plantation, in Davie, and one at the University of Miami.
Wow.
And there's nothing north of here for hours drive. So we're very blessed to have 3 ALS recognized centers of excellence meeting. They have met the threshold for patients, research. They have clinical trials ongoing. So there's a lot of hope and possibilities.
Do you know if somebody, wherever they may be, can get tested for the SOD1 gene?
That is a very good question. I'm confident that an ALS center would have that
capability.
Yeah. I don't know if they would say, "Hey, let's just test it for," and I don't know if an insurance company would approve it. Yeah. But I suppose if you want to pay cash and take a blood draw for it, I'm sure it's possible.
Right.
But if you have a family history, I'm sure there's even clinical trials available for you to be screened.
Yes, that's the main. This is the first, the Atlas trial that I just referenced is the first and only trial for people with the SOD1 who are not symptomatic. This is a big one. Because before this trial, I had no desire to get tested. That's kind of a controversial subject. I have people that say, "What do you mean you should get tested?" Why would I want to get tested for something that I can't do anything about?
True.
If there was something like, "Hey, get tested if you're positive. Oh, don't worry, you can just do this and prevent it." But unfortunately, ALS doesn't discriminate. It's like lightning. It strikes anywhere, anytime. And, it's just the strongest of people. People with bad diets, people with great diets, people who are out of shape, people who are in great shape. Yeah. But we never got into there's theories of how ALS is
just going to bring that up.
It comes about, right?
Yep.
Yeah.
So we've been talking about that 10% of people who have the genetic ALS, but then there's 90% who have the sporadic ALS. And so there's evidence that says that possible exposure to environmental toxins such as blue-green algae or heavy metals can predispose you.
Or any abnormalities or imbalances in certain cells, molecules, chemicals.
So what's interesting is the military is twice as likely. Yep. So military veterans.
Yep.
Yeah, so, very high.
Fortunately, the VA has good care for our veterans.
Do you know if there's any theories about that? Because I haven't seen.
Well, environmental.
Okay. Yeah.
Something environmental. Well, and I'll tell you a theory as well. So it's military and smokers twice as likely, both groups. But one of the theories is oxidative stress.
Oh yeah.
So what edaravone is a radical scavenger. It's that's how the theory. So none of the medications for ALS, the mechanism of action is unknown. The reason is because the disease is unknown.
Right.
So it's all theoretical. It's all theoretical. But they saw, so edaravone was approved for stroke in Japan. And based on the radical scavenger, type mechanism that it works, the theory applied, well, maybe this can work with ALS.
Well, that makes sense because
so that's how they got into doing the testing for ALS.
Right. Like a stroke is oxidative stress, heart disease, right? Yeah. And we've talked about that on our atherosclerotic podcast.
Yep.
So if you haven't listened, go back and you'll learn more about oxidative stress there.
Yeah. So it's like a super antioxidant.
Well, and like we said, chemicals, think of the military, they're exposed, all the ammo, and people don't realize every time you shoot a weapon, you're getting the lead on your body too, and heavy metals. In the flight, airline, can't talk today, but flying, right?
Yeah.
And Agent Orange was a big one.
But even strenuous physical activity has been linked to ALS.
Wow.
And I did not know that before we started looking into this.
And head trauma.
Yeah.
Well, I was just going to bring that up. A lot of football players.
Mm-hmm.
Right.
That's one of these. I think there's 5 different conditions that they're monitoring with the NFL players, like in an official way.
Oh, really? Yes. Studying that along the ways?
Yes. Sometimes in my neurology office in Miami, I find that, there's an NFL player who's part of that group.
Yeah. Interesting.
Yeah. So going back to my mom, she was in that car accident.
Right.
Could that have triggered? Yes, she had the gene, but what triggered?
That could have been the
trauma.
Oxidative stress, the head trauma, and anything like that. I mean, it's anything traumatic. And that's how we find that happens with a lot. Like we talked about that with the autoimmune conditions, right? Any trauma to the body, it could be triggering for any chronic illness almost, right? We can see that any trauma can be a new onset of type 1 diabetes, right? Somebody who's not diabetic at all. And we were just discussing that this past weekend. So, viral illnesses can cause it. And so I did see a few links with possible lack of hormones in women, particularly because progesterone is very neuroprotective. And so they were saying that could be linking, especially with the age range we're seeing, from 50 to 70. And that's right when women can hit menopause. So who knows, like you said, we still do not know enough about this condition.
Yeah. Yep.
And then I was reading about other, natural treatments and, talking about the vitamins and doing the hormones. And has anything come up in your line?
So that's a great question. A lot of the thought leaders use very large amounts of B12. Mm-hmm. So
because it's neuroprotective.
Not something that is, I don't think that there's any clinical evidence or any studies that have been done, but it seems from what I've been discussing that is something that is part of their protocol. So all the approved FDA medications, large amounts of B12, and that's how the experts are moving forward with it.
And there's been evidence that vitamin D helps in some neurological conditions like MS. So I'm assuming that it would be beneficial in this as well, even though I don't think there's any research that's been done to show that.
Right.
So, and then, and Joe told me something interesting before we started this podcast, that in this studio, there's a podcaster who records a podcast.
Tim Green.
Who has ALS.
Yeah, I was very, very taken back. What a very sad story, but very inspirational. I definitely will be checking out his work because he was a football player, a journalist, very accomplished in both. He's an attorney, and he has late stage ALS. And he does his podcast with his eyes. As people are advancing in their disease, you have a choice. Am I going to maybe get help with a ventilator? Am I going to fight tooth and nail with this disease? So they'll record their voice. Because eventually, once they lose their speech, they can use their eyes and the technology with the screen where they can speak and have a conversation, maybe a little delayed. But this wonderful individual is doing this podcast, and he says it's not about me, and this isn't about me and he's got kids. You can't believe he's doing this, but he wants to just interview people and learn more about their lives. It's very, very inspirational, and I was really very happy to see that he's doing that right in the studio.
That is, and I'm definitely going to check out his podcast.
Yeah, Tim Green. Yep.
Wow.
Nothing Left Unsaid is the name of it. Yeah.
So is there anything else that you can think that would bring awareness to our population?
June 2nd is recognized by Major League Baseball as Lou Gehrig Day. Oh. So in every ballpark in America, there will be a Lou Gehrig ceremony. A lot of groups and families, they get tickets and they go. And I have family in New York that makes effort to go, and friends. So that's an important date. I think it's important for people not to think that they have ALS because, like you said earlier, it's rare. Don't rush to make false diagnosis. Definitely speak to your doctor, not Dr. Google.
Right.
Yes.
No, but I'm just happy to be able to share a little bit of my life. I think it's made me a strong person, living with family members like this, and I just encourage everybody to. Be aware of the disease. Just know that it's very, very unlikely that you'll ever get it. And if there's a cause that's near and dear, support the cause and promote awareness. So. And
I know there's also support groups out there. If you have it or a family member of yours has it, go and join the support group so you can be around like kind.
Yep. The ALS Association in South Florida is great. They offer a lot of resources to patients. I remember in New York, my mom needed, all of a sudden you find you need a piece of equipment, a lift or a wheelchair, and they're right there to help you and offer a lot of help and support to patients. So that's a really worthy cause. Yeah.
Thank you so much, Joe.
Yeah.
This was very informative, and I hope we can get more awareness out there.
Yeah, I appreciate you both. Thank you.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.